Just brief introduction. This is just one of the seminars that we usually give once a month, last Thursday of the month. It's an educational series. They're calling it WSPT University, but it's just a basic introduction on anatomy, physiology, different types of conditions that are involved in shoulder pathology, shoulder injuries. So the more we find that people are informed about those types of conditions, about their own injuries, or about future possible conditions or injuries to their shoulder, to that body part, it'll be better for them to prevent it or recover from that condition. So it's just our way of kind of informing people about it. A lot of times people go to the doctor and the doctor just gives them a diagnosis that doesn't really cover the scope of what that injury is or what their potential injury could be. So this is our way of just showing a little bit about the anatomy and physiology. So Juan and myself are going to be conducting this presentation. So if you have any questions in between, it's an open forum, so please feel free to raise your hand, ask a question, or you can word out an answer a question you feel like you have. So Juan's going to take the first part just about the anatomy, brief physiology, so feel free to pay attention.
Okay, hello everyone. Thanks for coming and joining our presentation. First, we have part about the anatomy and the physiology part. I'm gonna introduce a little bit. This is the human shoulder joint. The healthy shoulder joint is a complex structure of bone, muscles, and you can see a ligament and tendons. Okay, the bones that form the shoulder joint. Shoulder joint, the scapular, the clavicle, the humerus. Humerus, this one is called as the upper arm bone, and this one is the collarbone. This is scapular, we also called shoulder blade or the wing bone. Again. Okay. Okay, good. This is the upper arm bone. The top portion of the humerus bone, there's a big rounded area. This one we call the humeral head. Okay. So which typically the raise against the scapula. So you cannot see the. You can see the picture here. The humeral head raised against the scapula. Against the small like a socket we call the glenoid. The glenoid. Think about this joint as like a golf ball on the like a T. It's very shallow. It's anatomically kind of unstable. Okay. And this the humerus and the glenoid covered with the cartilage, and also this joint encapsulated by a group of muscle. We call it rotator cuff. Okay, rotator cuff composed of 4 muscles. You can see the picture better. The front, this part is the subscapularis, and the upper top portion is supraspinatus, the infraspinatus, and teres minor. Okay, those muscles help to stabilize, make stability to shoulder and make also movement. When the front part of the subscapular muscle contract, they make a movement, the arm towards the stomach, and the back portion of the muscle contract, they make a movement, your arm away from your stomach, like this movement. So basically, rotator cuff arm muscles acting like turning in and outward movement. Okay? Should I already explain to you again? The same thing, it's scapula and shoulder blade. I think I explained again. How your shoulder moves. So not like other joints such as your knee or finger, elbow, those like a hinge joint, they movement across just one plane, just flexion extension, just one way, knee flexion extension. But this one is a ball and socket joint. Think about this. This joint make movement almost unlimited range of motion, the whole range of motion. Okay, so movement occurs in like this plane. We call the sagittal plane. So we call this movement a flexion, 0 to 180 degrees normal range of motion. And bring your arm back this way, extension on the sagittal plane, about 0 to 50 degrees is a normal range of motion. And abduction, adduction. And abduction from here, and we call this a frontal plane. So movement occurs this way, 0 to 100 degrees. Okay, this is normal, the range of motion. And turn in this way, it's about 0 to 50 degrees is normal. Okay, from here to inside. The internal and external rotation in this way, turning in and turning out. So either way, it's about 90 degrees. Degrees is normal, the range of motion. Okay, type of shoulder injury and dysfunction, the fracture. The fracture, you guys know, fracture is broken bone. Usually it occurs as a result of direct, injury, such as like a fall down, when you guys fall down, or a direct blow to the shoulder. Okay, you kind of fracture. The main symptom of fracture is, severe constant and pain to the shoulder local area, and your skin color turned red, swelling. Yeah. And frozen shoulder, we also call this as a adhesive capsulitis. We still don't know the clear reason what causes the frozen shoulder, but when you frozen shoulder, your shoulder initially feels a little pain. It becomes getting worse and worse. Your pain is getting severe, and shoulder joint is getting stiff, and you're gonna lose your range of motion. So even though we still don't know the reason, what's the cause of frozen shoulder, some risk factors for the frozen shoulder, such as patient with diabetes have a high chance to have frozen shoulder. From the research that about 10 to 20% of diabetic patients experience the frozen shoulder. Other medical conditions like cardiac disease, Parkinson's, hyperthyroidism. So the medical condition also increase the high chance to have a frozen shoulder. About the other thing, some patients after the surgery, they immobilize for a long period of time, or after the injury, they don't move their shoulder. They increase the chance to have a frozen shoulder. Okay, so in our part, after the surgery or injury, the early movement of the range of motion is very crucial to prevent the frozen shoulder. Okay. And other rotator cuff tear, impingement, bursitis, tendinitis, those things can because the result of overuse your joint. When you overuse your joint, pulling, carrying, lifting, and usually get injured. For example, rotator cuff tear, as I explained to you guys before, this muscles with the rotator cuff. Okay, when you lift up your arm this way, to make a distance space between the acromion and the humerus, it's narrower, right? So the human, the normal, the healthy shoulder joint is okay, usually it's okay. Some people inherently they have some narrow space, while people who overuse their joint or they develop the arthritis, the bone spurs grow up. Sometimes they make a space in between the acromion and humerus narrower. So there's sometimes muscle impinge between two bones. That's what we call the impingement. So it's continuously you lift up, carrying, lifting over your joint. Sometimes your muscle get teared. So that's the rotator cuff tear. Glandular labrum. The inner side. This is a picture here. You can see the labrum. This is the outer part of the scapula. This is shallow. Okay. We contact. This is we call the glenoid and the labrum. Yeah. Yeah. Or you have some
I
problem?
had a tear there.
Tear of the ear? Okay. 2 months ago. And slap lesion usually happen, like a sports player, who usually do repeatedly overthrowing the baseball player or a tennis player. They have a high chance to injury that area. The slap lesion cannot see the picture. It happen the higher portion of the glenoid. So you can see inside here, the upper portion of the glenoid is tear that side. That's the slap lesion. And usually also occurs when the patient fall down, outstretch their arm, then they pull that part and get usually injury. Yeah. So like that. Okay. So usually people who have a slap lesion, they have a pain on the front part of the shoulder, and also pain increased with something lifting or twisting their wrist. Also can increase the pain on the front part. Muscle strain and ligament strain. Again, most of the shoulder injury happens with overuse their joint. Okay. And OARA, this is a stand for osteoarthritis and rheumatoid arthritis. The osteoarthritis happens with people with age or after trauma. Okay, people we have to use our shoulder almost every day, right? So as we age, bones wear out slowly, and the bones first grow up. That's like when the cartilage around the shoulder joint wear out and expose the bone area, and at that time it's really painful when you move your shoulder. That's the kind of osteoarthritis. And rheumatoid arthritis is kind of different type. It's a systemic problem. Like your immune system attacks the health, the body tissue, like a joint capsule, ligament, or tendon. So when they attack, they increase the damage, increase inflammation. Also same as inflammation in the joint, but its type is kind of different. So next part, the Michael gonna discuss about risk factors for shoulder and dysfunction. Mm-hmm.
Just gonna pass the torch along. It's the first time using the microphone because we're doing it on the webcast too, so hope it's not too much of a distraction. Okay, so anyway, Guan did a really good job of explaining some of the anatomy of the shoulder, how a lot of the rotator cuff muscles play a fact into shoulder pain and types of injuries involving that, and also the labrum. Some of you guys have had labral tears, which is that cartilage where you have a tear there, and it can all cause a lot of instability inside the shoulder. But let's see exactly what risk factors there are involved in having those type of conditions. Some things that we can control and some things that we absolutely can't control. Thanks, Juan. So some of the risk factors are structural. So sometimes people are just born with that predisposition to injury. So the acromion, just like Juan was talking about, is that piece of bone that sticks out from the scapula. So you can probably tell better from this here. So the acromion kind of sticks out right underneath here. So from the shoulder blade comes out, and a lot of the rotator cuff muscles, specifically the supraspinatus, runs underneath the acromion. So there's that little bit of a space underneath there. Now sometimes people are just born with a little bit more of a curvature of this bone. So there's more of a growth there. So instead of being flat, it's a little hooked over on top of that rotator cuff muscle, the supraspinatus. What's the significance of that? Well, the more that's curved, again, that space has been decreased a lot. So that just means that a person is more disposed or has a disposition towards injuries of the supraspinatus or an impingement syndrome, where that bone will start pushing onto that muscle, and over time, because of repetitive movements and a repetitive pressure on top of that muscle, will first cause tendinitis or an inflammation of that muscle.
then as the inflammation progresses and you still have more pressure on top of it, can cause micro tears, small tears in the muscle. And again, if nothing's done at that point, it progresses to a full tear or full thickness tear. And at that point, surgery may be one of the options that need to be done to reattach those two pieces together. And we'll talk a little bit more about that. But that's one of the preconditions or predispositions that a lot of people will have to shoulder injuries. That's why people ask, well, why do I have shoulder injuries when I do the same type of work as somebody else in the same field doing the same movements? Well, structurally, sometimes that can be a factor of that. There's another structural change. I mean, if you notice in baseball players, what do you notice about pitchers that maybe most people don't have in relations to their shoulder? What makes an excellent baseball pitcher? Anybody can guess. All right, accuracy. What about speed? What can you do? What increases the speed of the baseball? Right, muscle strength. But there's also another really important thing that only certain few, because some people can exercise and strengthen the muscles the same way, and one person will be a lot quicker than the other. So it's something structurally. Yeah. Right, throwing, rotation. That's a big factor. And what a lot of times, if you notice just from this picture, look how much rotation this pitcher has. I mean, his shoulder's going much further back than I can right now. So that rotational component just means that that socket area where the labrum attaches to the humerus is a lot wider. So that's why a lot of times these baseball pitchers are a lot faster than you and I, because we don't have that structural difference or that ability to rotate our shoulders further back, because their socket joint is probably a little bit larger, and over time with training, with stretching, with strengthening, probably increase that even more. So they have a lot more of that. Now, the negative side of this type of movement is also you're more prone to having injuries. So the larger the socket joint is, the more you have that tendency of the humerus of popping out of that joint too. Because you have so much movement there, of course, more movement can cause more dislocations, more subluxation, which is a small dislocation, causing more injuries. So people that in their career require a lot of rotational movement in their shoulders can, for one thing, be more prone or more susceptible to slap repairs, because the cartilage around there, the glenoid cartilage, actually tears the further back you go. So you can have more injuries, just like Juan was saying, a slap repair or Bankart repair, which is the cartilage tearing itself. Another risk factor, again, structurally, people that have rounded shoulders. So posture is another big condition. So people that are sitting down with forward shoulders at a desk sometimes can have maybe a higher risk than somebody that's doing active work and has better posture while they're doing, even construction work or high lifting work, because somebody with rounded shoulders, again, will do what with the acromion if the shoulder is tilted forward? What happens to that? Right, again, that puts more pressure on that rotator cuff muscle. So the further your shoulders are rounded, the more chances that you're going to end up getting some type of condition or impingement or small tear inside the rotator cuff muscle. One of the supraspinatus muscle has that higher risk. Another thing is winged scapula. So if there's no stabilization of the scapula, so if people are doing a lot of lifting and they don't stabilize their shoulders, if they don't lift with the proper posture, you can actually cause a lot of shoulder winging, which means that those muscles behind you in the shoulder blades actually weaken, and again cause a lot of instability inside the shoulder. And that's another key word. The more instability you have, the more risk you have at getting some type of injury in the shoulder. So that's why it's crucial to make sure that you have all those muscles working correctly and stable while you're doing any type of activity. Forward head is another thing that's related to posture, and same thing, kyphotic thoracic spine, which is the mid-back. So people that are, and it goes along with the rounded shoulders, people that have forward head and rounded shoulders will also have a kyphotic back, meaning a rounded upper or mid-back. So Typically, you see this with office people that work in a desk, slouched forward. Again, closes up the entire front aspect of the shoulders, causing higher risk of injury. So that's an important thing to consider. We'll talk about exactly what you can do to prevent that posture. Age. Unfortunately, yeah, the more you become older, or as our age increases, of course, our risk factors also increase too. And one reason because of that, Guan talked a little bit and touched a little bit on that, was there a lot of times some causes of injury are spurring or arthritic changes, again, to that bone across the acromion. So as we age, the body, for some reason that's unexplained, starts producing more calcium over some areas, again, closing up that space and putting more pressure onto the rotator cuff muscles, causing more risks of injury. So that's another thing. Gender, not so much. There's not so much of a risk factor. Occupation, we said yes. Now, what would you think? Is there a higher incidence of shoulder injury with people that are blue-collar workers or those that work in offices or at a desk? It's more office type work. To build up over time of being in a bad posture, overreaching for things, poor workstation setup, that can cause a lot of these type of conditions, and not knowing exactly what type of movements may cause that type of injury. Just reaching for books. I know one patient just recently I saw, she was just taking a scale from a top shelf, lifting it and bringing it back down, and she ended up getting a pretty bad tear of her rotator cuff muscle. Nothing heavy, nothing super heavy, but just that movement and deconditioned activities, just sitting down at a desk, can cause those type of injuries. So it's really it's eye-opening to a lot of people that some people that really don't do anything strenuous throughout their lives end up with these type of conditions, and it's because of that, because they're not aware of what they're doing, how they're doing it, and not increasing their flexibility and their strength and stability of that shoulder joint, and any joint for that matter. So this doesn't only refer to the shoulder, but goes for the back, for the knee, for the ankles, the hand, the wrist, every part of your body. If we're not taking care of it, if we're not doing the right things, if we're not in the right body mechanics, we're going to end up causing injury over time. Recreational activities, I mean, those are some things that people that are in the athletic field can have more risk of injuries, more traumatic type of injuries. Sometimes those are almost impossible to prevent. Sometimes people just lose their balance or trip or fall. So those are things that really are uncontrollable to a certain degree. If we're more aware of things in front of us and we're more careful, you may have less of those type of risks, but not as controlled as the other factors. So prevention, like we were talking about, maintaining proper posture. And I always stress this almost at every lecture. I always tell people how important keeping a good posture is. Without that proper posture, you'll end up with the rounded shoulders, the forward head, the kyphotic back, and all those injuries, those risk of future injuries associated with it. So proper posture is really important. I'll give you an idea what the proper posture should be. Strengthening the rotator cuff muscles. So funny as it is, I see quite a few people that are coming in that are bodybuilders with those type of injuries, with shoulder injuries. And why is that? Because a lot of bodybuilders, what do? What's their main goal? Yeah, lifting. But are they doing very light weights, 10 pounds, 15 pounds? Heavy weights. They're bulking up. What the bulking up does, it just strengthens the muscles on the outside. So the deltoids, the upper trapezium muscles, the pectoral muscles in the upper body. But a lot of times with a lot of these bodybuilders and people that go regularly to the gym, what they forget to do is also strengthen the rotator cuff muscles, the internal muscles. The rotator cuff muscle, what it does, it stabilizes the joint, which allows you to start lifting heavy weight. Now, if those muscles are weak, there's no stability at the joint. So you go to lift something that's really heavy, the deltoids and these strong muscles are able to do the lifting, but what happens at the hinge joint, at the joint itself, there's nothing that holds the head of the humerus inside the socket joint, so that shoulder will pop out of place or cause a tear or cause a labral tear. And I see quite a few people doing that when they try to really force a lot of weight. And if there's an instability, or if they're weaker on one side because their rotator cuff muscles aren't able to sustain that type of weight, that shoulder, sure enough, will go back and they'll sustain a labral tear. I just finished seeing a patient who had a labral tear, and fortunately enough, he didn't need surgery. We did the therapy, and he was actually pretty good. He was able to go back, but now he's more aware, more conscious about what he should be doing, how he should be strengthening his rotator cuff muscles and stretching the areas that are tighter so that he can prevent those type of injuries again in the future. So again, very important to strengthen not just the outer muscles but the rotator cuff muscles, avoiding activities that can compromise the shoulder. So thank goodness we're out of the winter time, but in the wintertime we actually see quite a few people coming in with injuries, not only of their knees or their backs, but their shoulders, because they're doing a lot of shoveling or lifting, salt bags, things that they're doing that's not in the proper biomechanics, not in the positions that they should be. So overreaching things. So keeping a weight in front of you and overreaching with your arms is going to increase that load on your shoulder. So the key thing when you're lifting anything, and I'll show you an example of a proper lifting technique, whether it's something very heavy or something very light, you always want to make sure that you're keeping those weights or you're keeping that load very close to your body, to the center of gravity. Because the further that weight is away from your center of gravity, the more load, the more stress on your shoulders, the more stress on your back, on your neck, and so forth. So if we're lifting something heavy, let's say it's a bag of sand or laundry baskets, for people that are that are doing laundry during the day, if you're keeping something close to you, your elbows are at your side, you're keeping that basket, that box, that bag, whatever it is that's heavy, close to your body, and you're using the larger muscles, like the quadricep muscles, and keeping your back straight, keeping your shoulders to your side, using a lot of your bicep muscles, or the muscles that are a little bit wider, a little bit stronger, to be able to do those type of lifting. So doing those type of movements, again, will decrease your risk of future injuries to your shoulders. So a lot of times people do that. Another high-risk activity is the overreaching, and that's probably one of the highest that I've seen with shoulder injuries, especially tendonitis and rotator cuff tears. And again, it goes down to the space between the shoulder. The further you move your shoulder up, the less space there is in between the acromion and the scapula and the rotator cuff muscles. So if you start lifting, not only do you close up that space, but you start really putting a strain on that rotator cuff muscle. So if you're lifting and you're really pulling pretty high to lift something up over your head, that muscle becomes fatigued, becomes tired, and over time, once it fatigues, it goes into a muscle spasm, becomes irritated, and it swells up and it starts putting pressure on top of the acromion. The acromion starts putting pressure on the muscle, and you start getting inflammation, you start getting some small micro tears, and that could be the precursor to a lot of conditions such as frozen shoulder. You start getting pain in a certain area, people stop moving their shoulder, the shoulder locks up because you're not using all those muscles in that area, and you end up with a condition called frozen shoulder, which is 9 times, 10 times worse than the actual inflammation or the tear. So the idea is, if you're going to do something over your head, make sure that you're getting as close to that object as possible. Just like the picture shows, if someone is changing a light bulb, make sure you don't overreach on your tippy toes and start turning for a good 5 minutes trying to get that light bulb in there, because that is definitely going to cause some type of shoulder injury, continually doing that over time. Bring up a stool. Get close to whatever you're grabbing or lifting. And if you start getting tired, don't force that arm up. If you start feeling fatigued or some type of pain in the front of your shoulder, stop. Take a break, relax, and then try it again. That in itself is going to prevent a lot of those types of injuries. And again, strengthening the rotator cuff muscles. So those are one of the exercises we have people do in physical therapy. And maintaining a proper posture. So I want to give out just a couple of these, because I know people always ask me later, well, how should I be seated down when I'm at a desk? What's the angle? Should I have my arms up, arms down? So this way, you guys can always have that. Want to share? and a proper standing posture. Both are really good to keep in mind. So whether you're sitting down, whether you're standing or lifting anything, these are the postures or these are the positions that you want to stay in. So if you're sitting down at a computer desk, even if it's more than 5 minutes or less than an hour, you still want to maintain this posture. So your back always straight, your shoulders at your side, your elbows at your side at about 90 degrees, rested on top of the table. If you have some type of wrist support or even a towel, a rolled towel underneath your wrist, it's a good idea to do to prevent any type of wrist injuries. Keeping the screen, the computer screen, at about the top third should be at eye level of the screen. So you shouldn't be looking up, shouldn't be looking too far down. Your head should be directly, or should be straight. Your eyes should be directed at the top third of the computer screen. So they've noticed that puts the least amount of stress on the shoulders, on the neck, and on the back. And if you have some type of small support on your feet while you're sitting down, that's also a good idea, especially if you're doing it for a long period of time. Standing posture, also really important. What I tell people is picture an imaginary line going from the top of your head all the way down to the bottom. So that's the line that you want to try to maintain. A lot of times because of being in a certain position for a long time, we get out of that. And it's over time you become used to a certain position out of the normal position. So it may take some time to re-educate your body. But making sure that your ear is aligned with your shoulder, which is aligned with your hip, to your knee, and to your ankle. So a lot of times you'll see people, with their ears much further than their shoulder. So if you kind of look at yourself in a mirror, it's a good way to kind of address that problem and kind of get a good feeling of where your center should be, where that alignment should be, from ear, shoulder, hip, knee, and ankle. And even if you don't have that position, if you keep trying to get into that position, try to force your body a little bit at a time and be conscious about it, your body will slowly adjust to it. And you'll have less pain. If you do have pain in your neck and pain in your shoulders, a lot of times all it is just a question of changing your postural position, whether it's standing or sitting down. So that's another important thing to do. So follow those type of instructions in those positions. Again, another thing, what we talked about, those aggravating positions, the overextension, overflexion of the shoulder, reaching for things and keeping that position. This pain over here, after a while, after a good half hour of doing that, if he's painting again with that same position, is going to end up, maybe not now, but later on, with a lot of shoulder pain, shoulder injuries, inflammation, tendonitis, and tears eventually in the future. So that's why we want to avoid any of those type of positions. A good home exercise program for people that have shoulder injuries or don't is really important. It's really crucial. Stretching a lot of the rotator cuff muscles, so keeping them limber and keeping them strong. So keeping the length of these muscles always at a certain amount, always keeping them stretched out, and always making sure that they're strong enough to carry the loads that you're doing with everyday activities, everyday exercises. So the stretching, the strengthening, and stabilization, not just of the rotator cuff muscles, but a lot of the scapula muscles, so the shoulder blade muscles, so the rhomboids and the upper trapezius muscles. Those will stabilize the shoulder and prevent your shoulders from arching forward or causing that rounded shoulders effect. So the stronger they are, the more stable your scapula will be. The same thing will take effect on your arms also. So you want to make sure that you're doing a lot of those exercises too. And that's something it's easy to say to do, but unless somebody actually shows you how to do them, what exercises to do, it's hard to know on your own. So that's why, going to a physical therapist, going to somebody that's informed and educated on what type of exercises to do is worth going through and will prevent injuries in the future. So again, the treatments that we usually offer when we have people coming in for shoulder injuries, variety of shoulder injuries, is again proper posture, and I try to enforce that with most people, and I try to encourage that as much as possible. Aggravating activities, so we'll see what activities you're doing every day that can be causing that, and avoid that, move away from those activities and see what we can do to modify them to get yourself into a better position, better body mechanics. Taking an anti-inflammatory medication. So as a quick question, if you, by any chance, end up with a shoulder injury or any type of injury itself, the first stage is what should be your first plan of attack to decrease that, that pain, the inflammation, and the swelling? Okay, ice, and what else? Okay, maybe that you might want to stay away from because that's always the big question. Should I use heat? Should I use ice? When you first have an injury, there's an inflammatory response, which means that the body sends a lot of blood flow to that area. Starts heating up that area. If you add more heat on top of it, you actually start causing more inflammation to that area, which causes more pain and accelerates the nerve reactions in that area. So you want to actually do the opposite. You want to put ice over it, calming that area down, which decreases the swelling. The swelling will go down because there's already heat there. And another benefit of ice, which a lot of people don't realize, is by doing that, you're actually not only decreasing the swelling, but you're opening up the capillaries in that area. Because the more a muscle increases or a tendon increases in size, or any structure in that area, what do you think it does to the blood vessels in that area? Right, it constricts them, stops the blood flowing to that area, and you end up with a pooling of fluids in that area. So the fluid is really just a breakdown of the muscle and of soft tissue in that area. So what you want to do is you want to get a lot of that fluid out of that area. You want to get new blood flow. You want to get oxygenated blood flow to that area. So the ice is going to do that. It's going to decrease the inflammation. It's going to open up the blood flow to that area, and it'll actually prevent more injury to that injured area already.
How long should you use the ice?
Good question. As long as you start, if you have any type of pain in that area, or if you feel it's warm to touch, that still means it's inflamed. There's that inflammatory response from the body in that area. So as long as it's still warm, it's still painful to touch, still red, that's when you keep adding the ice. Once a lot of that pain calms down and it goes away, and you start feeling maybe just more stiffness than pain at that point, that's when it's a good idea maybe to start adding the heat. That means that the muscles shrank in size and there's still good blood flow in that area. The heat is going to add just more elasticity to the muscle. Another good thing, and that's why we usually do the heat before the ice in therapy, is just, again, to increase the elasticity of the muscle, the flexibility of the muscle, so that after you do those exercises, there may be some inflammatory response because of the movement. So now, just like a car, after you turn it on, you run it for a good hour, you want it to cool down, so that's why the ice is applied after it. So however long, sometimes the inflammatory response can take days, if not weeks, to calm down. So in that time, what I tell people is ice up as much as possible. It's one of the best anti-inflammatories and the most natural. You really don't have to take anything. It's just that cold sensation, the ice over it. So do it, I tell people, 4 or 5 times a day if you can, for about 15 minutes. No more than 15 minutes. As much as people hate the cold, you sleep with it? Oh, that's even worse. Yeah. The problem is if you keep it longer than 15 minutes, you actually get the opposite effect. You may actually get warming of that area. So you really want, just like as if you keep your hand outside in the cold without a glove in the winter, and you start holding on to a piece of ice for a long time, when you come back in, what happens to your hand? Yeah, it freezes and you have that burning sensation, the complete opposite of what you want. You get more inflammation from it. So that's why you want to really keep it about 15 minutes, no longer than that, 10 to 15 minutes, and do it frequently. So do it for 10 to 15 minutes, take it off, wait another half hour, put it back on, wait another hour to a half hour again, and just keep repeating that. And by that repetition of putting the ice, taking it off, putting it on, taking it off, that will slowly decrease that inflammation. And with time and over days, it may actually decrease it a lot quicker than if you did absolutely nothing to it. That sometimes, doctors will recommend the anti-inflammatories like the Advil or the Aleve or the Naproxen. Again, that just helps a little bit with the inflammation. If there's a really chronic inflammatory response, that might not even be enough. But the ice, along with that, is probably one of the best things that you can do. So I tell people ice up as much as possible when you have those injuries right away. there's an acronym for what you do after an injury. It's called RICE: rest, ice, compression, and elevation. So again, ice to cool down the inflammation, resting it, obviously not moving that particular joint, that particular area. Compression, so if you have maybe an ACE bandage to cover that area, to compress the area a little bit more, and then elevating it. So you get a lot of that drainage of that swelling back into the circulatory system, elevating it above your heart, because that will naturally bring a lot of those fluids back into your circulatory system. So that's a key thing to keep in mind with any injury, not just the shoulder, but anytime we end up with an injury, keep RICE in mind. Yeah, sure. Yeah. Right. Well, same thing. Same thing. It's, again, what causes that pain and that inflammation, that heat. Again, it's an inflammatory response. There's probably some micro tears in that area, inside those muscles. So typically, you would start out with the ice to calm it down. Again, getting more blood flow to that area. And that's really one of the key things for any type of inflammation, whether it's the shoulder, the neck, back. You really want to get more blood, more oxygenated blood. It's really your body's way of healing itself. And doing these particular things, you help accelerate that. So you help bring more oxygenated blood, so you let the body heal itself. So putting the ice, again, will help decrease the sensation of pain because the nerves react to heat and to ice. Heat will actually aggravate the nerves even more, will cause more of a chemical reaction. I don't know if anyone's taken chemistry before, but if you add heat to a chemical reaction, it just accelerates that chemical reaction. If you add cold or ice to a chemical reaction, it slows it down. And that's the same thing with our nerves, and that's why we end up getting that numbness if we add ice to a certain area, because it slows down that nerve conduction. So if we add ice to an area that's painful, not only do we decrease the swelling, we decrease the nerve reaction, the chemical reaction that sends pain down that pathway. And we bring more oxygenated blood, and we let the body heal itself with that means. And that may take days, like I said. If the injury is really bad, it may take days, it may take weeks, but be persistent with that and follow that, and it'll just decrease whatever injury you have to a lesser time. All right? I mean, does that answer that question? Yeah. Yeah, especially after whiplash or any type of injury, that's one of the quickest things. In X-ray, no. X-rays, just bones. MRIs, soft tissue. So muscles are soft tissue, ligaments, tendons. You'll only be able to see it on an MRI. Sometimes you can see it on a CT scan, sometimes, but more than not, it's just with an MRI that you can see some type of those muscles in that area. And if the tears are very small, you may not even see it in an MRI. You may feel the pain of it, but there may be just micro tears, so you may not even end up seeing it on the MRI. So that's why, again, those principles still are the same: compression, rest, ice, and elevation. All right. So the last few slides, just keeping up with if anyone ends up having to go for surgery, and there's some conditions that require surgery. Like we talked about before, if there's a complete tear of the rotator cuff muscle, there's no way that even physical therapy can take the two pieces and reattach them. At that point, it's only necessary that if you want to regain that movement, that a surgical intervention is needed. And that's with other conditions too, even like a labral tear. That's not going to really heal on its own a lot of times, especially if the tear is very large. So sometimes at that point, it may be necessary to go for a surgery, especially if those symptoms and that pain still persists. That's when a doctor will send you for a suggestion of a surgical intervention. But usually, I tell people, try the physical therapy first, try the conservative treatment first, see how your body reacts to it. If it's a very large tear or a very large condition, it may not do anything. But if it is small and if your body's able to heal itself through those means, it's the best thing. Because the last thing you want to do is put yourself back again, going for surgery, and then recovering again for those 6 weeks without doing absolutely nothing, and then a recovery of 6 months following that. So it's a long time to regress. If you can do it without that, it's all the better, and it'll eventually cause less problems down the road without the surgery. A lot of times scar tissue builds up even with surgery, and you may end up with problems down the road even though you've had the surgery. So it's a good idea to do as much conservative treatment as possible before considering surgery. Again, rotator cuff stretching, super important. Scapula strengthening, and a lot of stretching. When these are some of the exercises, some of the stretches that we go over with patients to build up strength and build up flexibility in their shoulders. All right, and there's just a quick video of one of the treatments that we would usually perform for shoulder conditions. Oops. Yeah, right. Caught my shoulder. No fraction. So those are just some manual techniques what we do. Those are mobilizations of the joint. So glenohumeral mobilization. So to increase the range of motion, we're taking the humerus and moving it downwards and upwards. These are called accessory movements. That'll help, especially with people with frozen shoulders, to get more movement into flexion, external rotation, internal rotation. So those are some of the manual techniques that we do. I'll fast forward a little bit. Well, and then the range of motion and stretching. I don't know who chose this music. It wasn't me. And that's pretty much it. I know you want to wait forever for this thing. Okay, let's go back. Where is that? Okay, yeah. So that's that. And then the other video is just a video of somebody going through some rotator cuff exercises. Again, the ones that we usually prescribe for patients, and we have them take home a lot of home exercises and exercise to build up their strength. So key thing, again, avoid aggravating positions. Make sure that your muscles are strong, the rotator cuff muscles are strong. Stabilize your joints. Just be very careful about body mechanics and what you do. So posture, 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 posture. I always tell people. And body mechanics. Be very careful what you do. All right. So if there's any other questions, you can ask myself. You can ask Juan. But we thank you for your time and for your attention. All right. Yeah. Hopefully everybody learned a little bit of something new. It's really super important. It's ice and posture, if anything. Yes.